Are you aware of fibromyalgia or the effects it has on its victims? Many people are unaware that this terrible disease even exists. Even doctors have a hard time trying to diagnose it, so many people are not receiving the adequate treatment that they deserve. I have witnessed this firsthand. It took my mother several years of unexplained pain, numerous doctor visits, and thousands of dollars in medical bills before she was diagnosed. Today I'm going to describe to you exactly what fibromyalgia is, its causes, its symptoms, and treatment plans to help patients deal with this illness. According to Benjamin Nadelson's article, Fibromyalgia, What It Is, and How It Relates to Other Unexplained Illnesses, fibromyalgia affects 3 to 6 million people in America, but its causes are still medically unexplained. Fibromyalgia is extremely hard to diagnose because there is no test that just says yes you have it or no you don't. People who have fibromyalgia also have symptoms for other diseases that share similarities with fibromyalgia, like irritable bowel syndrome and chronic fatigue syndrome. This complicates the diagnosis process even further because patients are just sent to several different doctors who are running several different tests for all these different illnesses. Goldstein and Perlmutter quote Dr. Bradley in their article, The Truth About Fibromyalgia. He says that it is almost like people with fibromyalgia have this pain filter that isn't working correctly. One study found that people with fibromyalgia perceive pain at extremely high levels. The reason this happens is still unexplained, but some doctors link it to there being severe amounts of stress in these people's lives. Although the causes of fibromyalgia are still unexplained, there are several symptoms that lead doctors to a diagnosis. According to Aaron Peterson's article, Fibromyalgia, Management of a Misunderstood Disease, fibromyalgia is the third most common rheumatologic disorder in this country. This disorder causes people to experience extreme pain, chronic fatigue, anxiety, and depression. Some other symptoms of fibromyalgia include mood disorders, poor sleep habits, stiffness, and headaches. None of these symptoms can be found with a simple examination or a physical examination of the patient's body. This causes people to lose hope in finding the source of their pain. In order to diagnose people with fibromyalgia, there are 2 standards that patients have to meet. First, they have to report chronic widespread pain for at least 3 months. Secondly, their doctors have to identify at least 11 out of 18 common tender points that are associated with people who have fibromyalgia. The most common of these tender points is severe pain between the shoulder blades. There is no cure for fibromyalgia, but there are possible treatment plans that some people find helpful. According to Sarah Ryan's article, Care of Patients with Fibromyalgia, a great way to deal with this pain caused from fibromyalgia is for patients to research the symptoms and the available treatment plans. Stress is a big part of fibromyalgia, so if people can limit their levels of stress, then they can usually manage their levels of pain. One way to prevent stress is to avoid stressful situations. Another way is to get plenty of mild exercise on a regular basis. A lot of people find that water exercises are the best and easiest type of exercise for people who have fibromyalgia. Another way to deal with the pain of fibromyalgia is through drug therapy. Some patients find prescription medications extremely helpful, and they are able to find a combination of medicines that help them deal with their pain. Others cannot take these medications though because the side effects are too severe, they're allergic, or they just don't want to have to take medications for the rest of their lives. The majority of doctors and patients agree that the best way to deal with the pain from fibromyalgia is to just try to live a healthy lifestyle. Their diet should consist of lots of fruits, lots of vegetables, and they should limit their intake of carbs. They should also avoid any foods that upset their stomachs because this can cause their stress levels to increase. And they should also remember to exercise on a regular basis. In conclusion, fibromyalgia has no cure or no sound diagnosis, and patients have to find their own treatment plans that work for them. I hope that one day a doctor is able to find a cure for for this terrible disease so that people no longer have to live in constant pain. Thank you.